Chairman. Thank you very much. Next is Senator Smith.
Thank you very much, Mr. Chair and Ranking Member, and great to be a part of this committee. I appreciate it very much, and welcome, Mr. Bessent. It's nice to see you again. I want to follow up a bit on the conversation that we had yesterday and just get into a little bit more detail, and actually some of the issues that Senator Sanders is raising. I'm focused on how we can lower costs for Americans and how we can make this economy work better for regular people in this country. And when we spoke yesterday, we talked generally about this. And you have said that you think our biggest challenge is to get after the deficit. And you've also said that your first priority is to extend the Republican Trump tax cuts, which would add $4.6 trillion to the federal deficit. And you've also said that the Trump Republican tax cuts have generated economic growth and that those benefits are going to have trickled down to everyone else. But what I see is that these Republican tax cuts have delivered massive consolidation of wealth at the top. Almost half of those benefits went to the top 5%. The top 1% got a tax cut that was 852 times bigger than the one that was received by the lowest earning working families in this country. And now these wealthy people have more money than they know what to do with. You see Elon Musk buying Twitter, and now he's got an office in the old executive office building and a seat on the platform when the president is inaugurated. And these tech billionaires are launching rockets into space and building themselves these lavish doomsday bunkers, buying up newspapers, all of which gives them more power. So what I want to ask you is, it seems to me that this concentration of wealth is not good for our country, and it is certainly not doing anything to lower prices for working families in Minnesota or help them afford a home or child care. In fact, it seems like it's doing the opposite of that. So could you comment on this?
Yes, and Senator Smith, I believe that President Trump, and if confirmed myself, are committed to addressing this affordability crisis. And part of the affordability crisis stems from this great inflation that we've had since the 2020. It was nascent in 2021. It occurred in 22, 23. We are still substantially above target. My hope is that we will not see it accelerating again. And inflation is one of the great killers for working families. As we talked about in your office, the CPI or PCE, the statistical numbers, may be up about 22% under the previous administration, but the basket of goods and services for working families. So getting inflation down, getting interest rates down, and addressing this affordability crisis.
And as you know, inflation is coming down. And one of the things that I think we saw during the course of the last couple of years was these big consolidated corporations with so much market power jacking up their prices way beyond the amount of money that they would have had to have raised their prices in order to cover their costs. So in my view, this level of corporate consolidation is actually hurting Americans. It is hurting the price. It's costing people more. And that, in fact, the Republican Trump tax bill that there's such a move to reinstate or to extend is going to contribute to that problem, not make it better. But let me ask you another question. You've also said that in order to get our fiscal house in order, we need to cut spending, we need to deregulate, and we need to privatize. So I want to just look at what we are seeing with some privatizing in the private sector that is of great concern to me. Let's look at health care. We've seen a move by big corporate investors into health care and especially hospitals. Terrible stories we've heard about rural hospitals and clinics getting shuttered, maternity wards getting shut down, and caused in part by this private equity big corporation purchasing and moving in and controlling, again, concentration in health care. And none of this, of course, has lowered costs for Americans. In fact, the opposite. People's costs have spiked. So I wonder, do you see this kind of model of big corporate takeovers of health care actually helping to lower costs for Americans? Senator
Smith, health care, I've probably had trying to understand healthcare cost and the drivers of that on my to-do list for 10 years to be able to sit in a room for a week and understand this, and I've never been able to do it. But I will tell you that when we see things like healthcare, like higher education, both of which have substantially outperformed any inflation index by cost, there is a problem there. I think that what you are identifying could be one of the problems, but I think the overall level of healthcare costs that we're seeing is driven by a multi-factor.
It is a complicated issue, and I know I'm out of time, Mr. Chair, but what I see, and we've done work on this, and Chair Sanders, when Chair Sanders was chair of the Health Committee, these big corporations come in, the quality of care goes down, patient costs go up. There's a hospital in Massachusetts that was bought up by one of these big firms, and they stopped stocking a common treatment for hemorrhage during pregnancy, and they've seen patients die. So again, I think this is an example of how privatizing is not a solution to our problems in healthcare or other parts of our economy. Thank you, Mr. Chair.
Thank you. Senator Johnson.
Thank you, Mr. Chairman. Mr. Bessent, welcome. Thank you for your willingness to serve. I want